When I'm treating the SI joint, I'll usually use this maneuver, this SI self-fix. It's kind of a muscle energy technique. Really easy to do. It's simple and it doesn't cause any pain. And I kind of use it both as a treatment and assessment. If I see them do this and they feel better right afterwards, I'm pretty sure that the issue is the SI joint. So I usually use a hockey stick. You could use a dowel rod. Hand this to the patient, hold on to it firmly, and it's a push-pull. So he's pushing down, pulling up, 5-second hold, 50% of your strength, 5 repetitions. All right, after he does that, he's gonna weave it through the other way. So the easy way to do it is just like that. Same thing, repeat, 5 by 5 by 50%. After that, I'll have him stand up and try to reproduce the pain if it's bending over, side bending, whatever motion was bothering him, and just to see if we made any change. And I usually will tell my patients, keep doing this until it stops making change or it's completely eliminated the pain.